Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. To wrap up the conversation, we asked, what's the big aha moment when it comes to understanding and improving quality metrics? We also look ahead to 2025. What's on the horizon that excites us, and what are we most looking forward to as we continue this journey in value-based care?
So, if you had to give the health centers one aha moment, what would you say?
Care coordination has the most impact. It was a new concept that we had to first, explain, was that there is a difference between chronic condition management and care management. And I think once we had that shift in mindset, we were able to get the conversation working outside of the four walls of the office and, engage the specialists, engage the hospital systems, engage the different providers that the beneficiary was outreaching to and receiving care at. Because that's one thing with MSSP, is that it's really driven by the financial outcomes. So how much is the total care of costs for this beneficiary? In turn, did they have bad health outcomes? Are they having uncontrolled hypertension? Is their diabetes unmanaged? And it becomes really aggressive in that aspect. And the one solution for that, and what we did see success in with REACH, and what I believe we can see success for in MSSP, is care coordination. Having that turnkey solution where you have a team who is solely focused on managing, doing the preventative care, doing the chronic condition management, the medication adherence, this whole comprehensive care plan that in turn meets all the different quality goals for MSSP. And I think that's one thing that needs to be a little bit more aggressive, because when we've done the outreach to our beneficiaries, they want something like this. And in turn, a lot of them, it addresses other issues, as we were saying before, with social determinants of health, where they might have social isolation and they have nobody, and this one phone call a week works for them. And so I think if we become a little bit more aggressive with that, we will see success, because we saw it starting to pick up in 2024. Now we just need to take it the whole way in 2025.
I would say the aha moment is coming. Wait for it. But you just have to be patient. I know that, we didn't see a lot of shared savings and all that coming in, but I think because the numbers are telling us that we are doing something right, we just need to keep making that effort with care coordination, teamwork, collaborating between FQHC and ABC network. I think we are geared for success. The momentum has caught on, so we just need to keep the momentum going and reach the goal that we are all hoping to achieve, and it will ultimately lead to shared savings. So that will be the aha moment.
Yeah, when we see the ROI, the positive shared savings.
Moment.
It was all worth it, the years.
It will come because evidence has shown that ACOs that are doing better, they are doing better for a reason. And, we are getting there. We have taken the right steps. We just need to continue that momentum, like I said, and we will have that. We will achieve that.
So as we wrap up, what excites you most, or what are you looking forward to the most in 2025?
I think I'm excited to see how creative we can get. I think doing those digital campaigns, doing, specialized chronic condition programs, we're focusing on certain measures. I think just seeing how creative and out of the box we can get. I think one thing we've seen is with this program, you do have to be a little bit more innovative on how you tackle certain issues. And the good thing is the early conversations I've had, there's interest for it. And I think there's so much potential to build that out. And I think, as Dr. Siri said, we'll then have that aha moment where we'll see that return and, we'll see the rewards for how much we worked. And so I'm excited to see that portion.
Yeah, I get excited when I get questions from the FQHCs. For the last month, because we were waiting for data from CMS, we were not very involved with them. We are not able to share anything with them. And they are feeling like, okay, why don't we have anything coming in from ABC, and then we get these questions from them. Hey, what's going on? We need to have a meeting, or we need to get together and see what's going on. What are the quality measures we are looking at? So when I get these questions, it makes me excited to think that, okay, they are thinking about value-based care. They know that there is something that we need to do, and what is that? Help us out. Yeah. So when I get those questions, I get excited, and I tell them, we are ready to help you in whichever way we can. We are just working on a few things on our side because it takes us time to get that data from CMS, get it all together and bring it to you. I just want to make sure that they continue to be involved with us, be proactive in reaching out to us with any questions. We can help them out in whichever way they want us to help, in whatever best we can.
Mm-hmm. I think for me, I'm most excited about our patient education branch. We are on the precipice of piloting that at one of our health centers. So we've got the go-ahead for that, and we're really excited to see what that brings, get some feedback, get better, and work on that health literacy piece. I'm excited for that.
Something like the patient education branch, it works because it's asynchronous and the patient can take it at their own pace. But then when you tie in a CHW or a care manager who checks in, engages, does those workbooks with the patient, and then you involve the provider who, sees that patient once a month, talks to them, do you have any other issues? It becomes this larger scale thing that goes way beyond just the LMS. And that in turn really does have an effect on the patient's life. And you'll see those improvements in their quality metrics and seeing those improvements in their condition, which in turn helps us with our quality scores and our risk scores and all these other big things that will, have a financial impact on us. But that's the idea right there. You need to see how one thing isn't just one. It's a big web and it interconnects, and there's a larger things at play. But that's where that creativity comes in, and you have to make sure to make those connections. And I think that's where we really can help. We've done our research. I've traveled to all these conferences. I've heard the best practices. Now we just need to bring it home and make sure that we're implementing it.
Any other thoughts as we wrap up our discussion on what we learned in 2024?
I think looking back at 2024, from what we see the quality measures are looking up like, I think we're geared for success. Just hang on to it, keep doing what you're doing, just wait for the aha moment like you just asked.
Thank you so much for talking with us about this today. I think it'll be really beneficial for those listening.
Thank you.
Can't wait till 2026 when we say the aha moment arrives.
Yes, for sure.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.